class, I had a massive issue. Like I said, with 32 people on one meeting, please, if you've got things going on in the background, make sure you mute yourself. It makes it very difficult for everybody. All right, let's move this.
This is our textbook?
Yep, this is the textbook. Because we are moving past medical terminology. We've gone over everything we need to cover: prefixes, suffixes, root words, and plurals. Everything else, y'all are going to have to put it to memory. You're going to have to use it to learn it, right? And that's where the flashcards and the quizzes and the games come in. All right?
What page is that? Sorry, what chapter is that?
Let me see 1 second. This is chapter 4, the second half.
Okay.
Okay. My PowerPoint's broke down into just two different.
Okay, I'm trying just to see the page number, but I can't see it.
I don't see a page number actually on my PowerPoint.
Okay.
But it should be the section that says gross anatomy and starts talking about directions and body planes. And I'm just not sure, and I don't know like with the actual book how it works. All right, so let's go ahead and get started with this chapter. One of the things that after we get past medical terminology and we start to understand the basis of how our words are put together, the next thing that we need to start tackling is understanding our body and understanding where it's placed and the placements and how to give directions and terms to our body. Okay, so direction is necessary because when we're referring to a bone, or we're referring to an injury, or referring to a specific site, being able to point out and give an exact description to somebody who's, let's say who's reading, who's not with the patient, but maybe they're reading the report. They'll know by the way that we give our directions and the way that we explain its location exactly where the injury was. I've given y'all a picture that looks similar to this, and I told you that I also gave you the organs, and I gave you the picture of the quadrants. Those need to be studied daily. You need to get into the habit of knowing that the difference. If I say posterior, I am talking about the back of something. If I say anterior, I am talking about the front. Okay? If I say superior, that means above. Inferior means below. Okay? And then transverse, because we know the word trans means to cut across. So a transverse plane would be something across, right? And then when we start thinking, there's going to be additional terms that we're going to add to this, like distal and proximal and so forth. But right now, the main things that I need you to understand, okay, is that when a patient, their front portion is anterior, their back portion is posterior. And do you see how the hand is placed? This is what's called the anatomical position. This is how we think of. So the way her hands are facing, this part of her hand is posterior and the palm is anterior. And this explains that positioning, and it's called the frontal plane. And some people call it coronal, but the frontal meaning the way that if you cut the person straight down the middle. like it from the starting at the head going through. And that's what this line is showing us here. Like if she was just chopped straight in half. Okay. And then when we, I'm trying to, oh, okay, there, where does it show this? Okay, so do you see how it's going through her? Like if she was cut into sections, like a left side and a right side, that's called the mid-sagittal. That imaginary line that runs straight up the person, okay? That's what that is. So the coronal would split them down the middle this way, and the mid-sagittal would split them down the center, straight down, okay? And then transverse would be like a magician and cut them straight in the middle, across, okay? And that's the first basics of, the front, the back, posterior, anterior, right? And getting those down, and then getting your planes down. It's very important, so study that. And then we have the PowerPoint here, and it shows us superior, above, right? And it's towards going towards the head. And when we think of anterior, this is going to be the front. This is going to be the front side of the patient. It's also sometimes referred to as ventral. Okay, that's another term you might hear it exchanged with. Now, posterior is so easy to remember because its other term is called dorsal, and posterior is the back. Well, what do dolphins have on their back? Dorsal fins. Right, so that's how I always remembered that. So I knew dorsal was posterior, and so the opposite would have to be ventral, which is anterior, okay? And sometimes you might hear a very old person say they're posterior, talking about their butt. And it just means because it's in the back. Cephalic means pertaining to the head or the head region. And then medial is midline, all right, or closest to the middle, okay? Lateral is meaning to one side. It's away from the midline, right? Now here's where everybody gets a little confused. Is proximal and distal, okay? Now, I'm going to tell you how I remember this, okay? If when you go and you're looking on to take a trip, you're looking to see what the distance is going to be for your traveling, right? So distance tells you how far you're going away, right? That's how I remember distal. Distal, distance, because it's meaning away from the attachment point. So my thumb is distal to my elbow. Does that make sense? Okay. My toe is distal to my knee. Okay. But if we wanted to turn that around, we could say my shoulder is proximal to my elbow. Because it's closer to the midline or the attachment point, okay? So when we think of the opposite, proximal, that means we're thinking about where the structure attaches. And if it's not an attachment point, then what the closest to being centered, midlined, okay? And that, I know that can be a little tricky for some people, but when you think of it as distal, meaning it's further away, like the distance, I think that kind of helps, Okay? So, and they use these a lot. They'll say, especially when they're talking about a patient that has a lot of wounds, or maybe when I think of it, as I know that burns, they use that term a lot, or gunshot wound, like a shotgun wound, because of the way that they spread. So this mark was distal to this or this or this, and this bullet, you know what I'm saying? When there's a lot of different things to describe, and sometimes they'll, if they're talking about one region of the hand, they'll name a specific bone in the hand and say it's distal to the wrist, or what, you know what I'm saying? So that's a good way to pinpoint the location. For example, you might discuss something in terms, I just explained that. Body cavities. That is that sheet that I gave you, that I sent to y'all. What is your body cavities? It's what contains all of your organs, right? Your cranial cavity, what does that contain? That contains your brain, right? Your spinal cord, or your spinal cavity, contains your spine. Your thoracic cavity, that's your chest. It holds your heart and your lungs. Your abdominal pelvic area or cavity contains intestines and stomach and reproductive and bladder. So that's that whole from the breast down cavity, right? And so if you hear them say it was in their thoracic cavity, or it was in their abdominal cavity, you'll understand what they mean, okay? And a cavity is just a hole, an opening, like a containment. It's hollow. And so we have our hollow cavities filled with organs, okay? Well, some people have a filled cranial cavity, other people not so much. We have a good image in the book, and it talks and it shows you. Here's the cranial cavity and housing the brain, the spinal cavity, the thoracic, and the abdominal pelvic. And these are different views that we're looking, right? So if I said, what is this plane right here? It'd say that's transverse, okay? And if I said, which way is this patient presenting? They're presenting anterior, right? So starting to get familiar with that, okay? Now, this still gets me somewhat confused. What this image is if you were looking at the top of the person's head and you had a magic ability, or, and you could see inside from the top of the head going all the way through, that's the view you're looking at. And they do this image a lot because it allows them to compare lung sizes, or it allows them to see the size of the heart in comparison to the lungs. They do this for the brain. There's a lot of different reasons they get this specific image. And and for the life of me, I cannot think of what that term's called right now. But when we think of the pericardial cavity, you're going to think of like the heart and its membrane, okay? So all of our systems have their cavities that they fit into. Now, as we move on, we start learning about body, more positionings, right? Now this, I'm going to give you a little cheat sheet and you're going to love it. And everybody always jokes when I hand it out. And I had one girl one time, I handed the worksheet out and she goes, "Is this homework?" I said, what do you mean? She said, oh, me and my husband can practice this weekend because it's a bunch of different positions. And yeah, right. And she had me cracking up. Prone means to lie when your patient is lying face down. Supine is when your patient is laying on their back face up. Lateral is meaning they're laying on one side or the other, right? And like I said, you'll have I'll post these slides as well. Then we have our 9, I don't know why they just threw this slide to right here. That just makes no sense. Anyway, we have our 9 abdominal pelvic regions. You have, and this is where I showed y'all those quads, the quadrants, and it's really important you get those down. And I talked to y'all about the left upper quadrant, the left lower quadrant. I talked to y'all about the umbilical, where's that? That's belly button, right? And then epigastric, that is all the way, if you follow your belt, put your finger on your belly button and follow it all the way up to right at the bottom of your sternum. That is your epigastric area. So if I point my camera, it's like right here. It's under the breastbone, okay? So that would be your epigastric. Your hypogastric is the opposite. If you took your belly button and went down right below the pubic bone, I mean right above the pubic bone is your hypogastric area, okay? Left hypochondric region, and this is just the another terms for those quadrants that I was showing you. The left lumbar, left inguinal, that's like around the groin. That's the area. When we see this inguinal or iliac region, that is where the thigh is meeting the pelvis. So that it's the bikini lines where your bikini touches your thigh, right? It's that area right there. And then you have your right hypochondric, low, hypo meaning low, right? And then you have your right lumbar and the right inguinal. Now, I don't have those on the diagram because these are not as commonly used, these terms right here. This is what we use, okay? This is what we're going to become familiar with. And what we need to know is your right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. I want y'all by Monday, I want you to have this down, and I want you to be able to tell me an organ in each one of these quadrants. Okay? And that's not too hard. What organs lie in each? That's what we were just talking about. That's what I want you to know. I want you to be able to tell me, oh, if I say liver, you're going to say upper right quadrant. If I say appendix, you're going to say lower right quadrant, so forth. Spleen, upper left quadrant, right? So I want you to get familiar with your quadrants. That's what this picture is here. And now it gives you a really great idea, right? You're able to see what all the words, put it into picture. This is where the magic happens for me, when I can understand. So let's take a look really quick. Okay, this is what they were calling the right hypochondriac, I said hypochondriac region. There's these sides over here. Okay, and then this is what is the we refer to as the inguinal or iliac. See this spot right here along the groin? This area here is what that is. You get a lot of hernias right here. A lot of people can get hernias here. When we talk about the way that the body structures lied out, and like I said, we can break it down to an upper right, upper left, and lower right and lower left. So please be familiar with these. And then this is also helpful because you can see umbilical, there's your belly button, that region. Epigastric is anything right up in this region. And then hypogastric is this area right around in here. We think of like the bladder, okay? Body, okay, anatomy, this is basic terms. So this is something you'd want to know what this meant. You'd write this and know this. Anatomy describes the structure of the body. Physiology describes its function and process. So that's why you take anatomy and physiology together. We call it AP, right? And our body systems are basically the organs, and they all have their groups, like the respiratory organs and the digestive organs and so forth. And this picture here, and it talks and it breaks down our systems. And we will go through every single system in our class. We will talk about the integumentary system, and we will learn about all of its structures, and then we will learn about it, so its anatomy, and then we will learn about its physiology, how it works, and what happens when it's not working, so its diseases as well, or illness, complications, injuries, that kind of stuff, right? And we will do that for every single system: skeletal, muscular, nervous, endocrine, cardiovascular, blood, lymphatic or immune, respiratory, digestive, urinary, and reproductive. So all of these. So this is here. I want y'all to get this, put this number into your mind. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Okay? And there, I like to say 12 because everybody always lumps blood and lymphatic with immune system. So, and we can do that. So this is saying 11 systems. Okay? And these systems are, knowing them are vital. Sometimes you'll go and work for a doctor who specializes in skeletal, bone, and muscular issues. That's called an orthopedic specialist, right? Maybe you'll see a dermatologist. That is a doctor who deals with the integumentary system. Maybe you'll see a neurologist. They deal with the nervous system. Maybe you'll see a gynecologist. They see the reproductive system. A nephrologist would be somebody specifically dealing with the kidneys, while a urologist is somebody who deals with the whole kidneys, ureter, bladder. There's a gastrointestinal doctor. There's pulmonologist. There's epidemiologist. There's hematologist. There's all kinds of different doctors that fall into this category of blood. There's cardiovascular doctors, right? And then there's endocrinologists. So there's multiple doctors in these different lines. So when we'll get around it, but start being able to, I'm going to give you a list of doctors, professions. Have I given that to y'all yet? I don't think I have. It's their profession, what they're called, along with what they treat. Like an endocrinologist treats endocrine. Okay? We just covered this. What is integumentary? Oh, do we need to write all this right down right now? Nope, because when we cover it, we're going to cover it, okay? So just know it's your skin, okay? And then it has its own very set of special words, of terms, like like when we talked about adipose, and I just completely had a brain fart what I was fixing to say, and I apologize. Cyst, when we think about that, that's a fluid-filled sac. Derm, or any of or other commonly referred to, or dermo, this isn't, or cutane or cutaneous, right? This is what we're talking about when we think of skin. And epi is like on, right? Upon something like our skin, or epidermis, right? I'm going to give you a list. When we go, don't worry about this too much, because into system, I will assign the chapter in the medical terminology book that accompanies it. Does that make sense?
Yeah.
Okay. The skeletal system, just bones. Think about bones, but something else. I want you to put a little star, or, remember this. I also want you to think, when you think about the skeletal system, I want you to think about immunity and blood. And a lot of people forget that our bones are our source of blood production. Okay, so it's not just about minerals and structure and keeping us from being a bag of flesh. Bones do very special things as well, and they have they have their own terms: artho and blast and clast and costo. Costo's ribs, malacia, softening, osteo, bone. So lots of different terms, but like I said, when we cover that, I'll assign those with it. And then we have our muscular, and that's muscles as in, like, pumping iron and getting big old muscles, but that's also heart muscles, and that's also the tissue surrounding those muscles. And we'll learn those, and they have their own set of individual terms. Like anytime you see myo or it's muscle. If you see the word dis, that's bad. Delt, like your deltoid, this means triangular in shape. Tri, 3, triceps, right? Vast, large. So there's lots of different terms that go with each. And we're going to be talking about that, like I said, as we go through the systems. Your nervous system, when you think of the nervous system, I want you to associate spinal cord and all of the tiny nerves throughout your body, the millions of little nerves. And we'll talk about all of them. And they have, of course, their own set as well. Algia, it means pain. Astro means star. And that's kind of neat, because we have cells in our brain called astrocytes. And if you ever get a chance, Google what one of them look like underneath a microscopic advanced telescope. They're beautiful. Micro, meaning small. Moto, meaning movement. Neuro, for nerve. Olgia, this means scant or few, right? So we'll go through these terms. We'll learn these as we go. Our special senses, that was one that wasn't on there, was there? That's good. I knew there were 12. That's what they've got. Special senses. We'll cover that too. Vision, hearing, taste, touch, smell. And they have their own as well. Aqua, obviously water. Glosso, this refers to tongue. It's weird, huh? Gust, that's taste, right? Lingo, that refers to the tongue. Opt, the ear, and ought. I'm sorry, opt is eye and ought is ear. So that's why you'll hear of optic drops, right? Because optic is eye, right? And we'll get familiar with these. So please don't let it seem intimidating right now, because I'm not throwing all of this at you at once and say, here, catch, learn this. We're going to learn it. We're going to learn it system by system, okay? And it'll make life a lot easier. Cardiovascular, when you think of cardiovascular, I want you to think of the heart and all of your veins and arteries. So it's not just this thing right here pumping and beating, it's every little vein and every little capillary and every little artery that runs from the tippity top of your head to the tippity top of the bottom of your toes. All right, so it's the full body, and it's not just the heart. Okay, and of course it has its vein, which is vein, vaso, which is the vessel, stenos, that means the narrowing, rhythmo, that's like we're talking a heartbeat, right? Necro, that means death, and necrosis, that's where that word comes from. Cardi, heart, arterio, or arth, am I saying this right?
Arthur.
Yeah, athro. Now I got it. Okay.
Arthur.
That's, yeah, and that's the fat and plaque, right? And so that's bad, because we don't want I can't even speak today. Atherosclerosis. We don't want that. That's bad. That means you got fat and plaque all in your arteries, right? And we'll get through all of these, and I promise you, I love teaching cardiovascular. The immune system. When you think immune system, it says it everything. It's in its name. But I also want you to think, yeah, it's not just about your immunity, but it's also about your blood, and we're going to learn about blood during that. And we're going to learn about the lymphatic system when we learn immune system. And there's all kinds of cool words with the immune system. Micro, again, we see here. Where do we see that? We saw that with neurology. Small, leuco, white, macro, large. Base, this is blue. But there's another word, cyanosis, right?
Yep.
That means that. Bacteria is for bacterial. Cyte is for cell. So there's all kinds of, kind of really cool terms that we'll learn as we do these. Respiratory. So our respiratory system is our lungs, right? And all of the accessories, like the bronchial, the bronchus, the trachea, the pharynx, the mouth, the nose. So that's our respiratory system. And we will learn its special words like pneumo and pnea and orth, meaning straight, and pi for pus or infected. Thorax, meaning chest. So we'll get familiar with those. And our digestive system, well, I think we all pretty have a good idea what our digestive system does. But what do you think of when you think of digestive? Most of the time we just think about the stomach, right? But the digestive system is so much more. It starts at the teeth. It starts at the salivary glands. It's down to the esophagus and the stomach and the intestines and the rectum, the anus. I mean, we have a long canal that starts at one end and goes out the other. And we'll get familiar with these structures, and we'll get familiar with their terms as well. And this is one I'm always throwing at y'all. Chole. Chole, anytime you see that, C-H-O-L-E, is gallbladder. All right? Dent is teeth. Gastro or gast is going to be stomach. This is something that you're going to hear when we talk about digestive, and it's called retro, and it means behind. And I'll give you that perfect example, the retroperitoneal. That means that area right behind the, hold on, the abdominal area. This is a rare sight. Look who come to visit me.
Hi.
This is Juno.
Hi, Juno.
This is my grand kitty.
Oh.
Yeah, hi, baby. Is she pretty? She's a nebulum. She's a big, sweet girl. And she normally doesn't like grandma. She's like, whatever, grandma. God. So we'll learn about the shape, the prefixes, suffix, and root words that go with this as well. I always thought this one was cool too. Sigmo, S-shaped, and that's because our sigmoid colon is shaped like an S. It's actually it's neat when you start thinking how these relate to the systems and the bodies that they're speaking about. Our urinary system, I want you to understand that it is so much more important than we give it, and it does so much more than we give it credit for. Because did you know that if your kidney is functioning properly, you're going to make it maybe 24 to 48 hours without going into some type of cardio or systemic shock. Your kidneys are life, and we don't give them enough credit. And so your urinary system, we like to think of our kidneys, our ureter, our bladder, and our urethra. Now, I'm going to tell you something interesting. If somebody comes in and I see in the ER, the doctors would order a KUB, and that's because they wanted to see what happened in the wreck, right, to their kidneys, their ureter, and their bladder. So if you hear that expression, they're usually talking. They want to see those areas. And the urinary hesits as well. And these are ones, and this is why I'm going to tell you this. Almost every patient that comes into your office, no matter what doctor you work for, the doctor's going to want a urinalysis. Why? Because the urine tells us so much. Does it tell us as much as blood? No. Is it to get a urine sample? Pretty easy, right? So we do urinalysis on almost every patient. So we need to understand these. Cysto is anything dealing with bladder. That's why if a patient has cystitis, they have a bladder infection. Hemato, blood, nephro, kidney, olgia, we saw this before. It meant scant, right? Poly, many. And that's why I was throwing all these words. And where's my favorite? Where's urea? It's not up there. But urea meaning dealing with the urine itself. They have uro and urine, but it means urinary. And those words I want y'all to really be familiar with and make sure that you understand. Endocrine system. Now, that's also another highly underrated system, because when it works right, we don't ever think about it. We never think about the endocrine system. But when it's not working right, it can actually wreck your entire life. Because our endocrine system is our hormones, our thyroid, our adrenal glands, our pancreas, so many things. And part of homeostasis is maintaining a healthy endocrine system. All right, and we'll learn about that. And it has, of course, its words, and these are the really common ones. And see, look what's right there: stasis, stable. Lact for milk, gonad for like sexual organ, gest for pregnancy, for gestation, endo for within, endocrine, exo for exocrine, right, to excrete, or we're going to learn about all of these, okay? The reproductive, when we think about that, we think of our reproductive organs. We think about, if we're men, the testes and the penis and the prostate, and right, and testosterone. And of females, we think about ovaries and uterus and vagina and estrogen and those sort of things, right? So we're going to learn about the different parts with both male and female. And they have their own terms, like MAM and UFO, and I've never been able to say this word right. It's orchid, and I still don't say it. Test, and for testicles, cervix for like the cervix, but it basically just means neck. So we're gonna learn about all of that, okay? We're also going to learn, as we go through these systems, their diagnostic terms when we're talking about disease and disease process, as well as their procedural terms. Like if we had here's my favorite, cholecystectomy, right? Removal, okay, or scopy. So that's why knowing these terms, right, is going to benefit you as we move through each of these chapters. Okay, and then this is just giving you a term, because it said right here, diagnostic terms. So diagnostic terms, common ones, all right, algia, pain, itis, inflammation, right, penia, abnormal or low or lacking, trophy, no, it's not trophy, it's trophy, but it's growth. So atrophy. So if we put A in front of this, we actually have the opposite of it, meaning shrinking, atrophy. That's what happens, like, you know, when a muscle starts to wear away. So it's amazing that we can go from growth with here, right? And then just smack an A in front of it, and now we actually have the opposite term. You see where I'm going? Why these terms are so important. And I'm going to, oh no, there was integumentary too? Oh no, we already talked about that. Okay, I'm going to leave it here because we're at almost 50 minutes. But does anybody have any questions or anything they'd like to discuss while we go through this?
I did have a question, but I forgot.
I know, because I just, you're supposed to stop me. You're supposed to say, Miss Scalp, shut up, I got a question.
Oh, yes, I do have a question, but it's about labs.
I don't know any. I have a meeting at 1 o'clock, and that's what I was going to tell y'all. I have a meeting at 1, And we had an instructor who was doing online. She's no longer with us, and so I don't know how that's going to affect everything just yet. I have a meeting at 1, and I'm going to let everybody know when the lab days are, what time they're going to be, and then as soon as I know that, I'm going to post to WhatsApp, and I'll let y'all know. And I'll also get grades updated, okay?
Thank you.
And then once I do that, then I'll message everybody and let everybody know, okay?
Okay.
Miss Carl.
Yes.
Yes, I sent you my question on a private message.
Let me see 1 second. Whoa, she said, I'm about to fall off the couch because somebody just sent me a survey.
Yes, about the survey monkey, they said.
Huh. They can't see it, huh? Okay. I will send them, and I will make sure that they know that this has been happening. Guys, Jimmy, I'm going to use you as an example. This is why I tell you, send me pictures of your screenshot every single day. For some reason, the system is not picking up. And there's been about 6 students that me having a picture like this has literally saved them because the system didn't pick it up. They got 0 attendance. But I said, oh no, this is why I have my students send me pictures, and they got the attendance. Okay. So
Yeah.
always send me your screenshots. Okay.
I don't have.
Mhm.
Yeah, I don't have a WhatsApp on my tablet. They said I have to do it on my tablet. But how can I send it to WhatsApp? Or I don't have WhatsApp on my tablet.
You can go open your browser and you can download WhatsApp, or you can use WhatsApp directly through Google on your tablet. But I'll send them, don't worry, I'll send them all of the proof of your Survey Monkeys, okay?
Okay.
So you
But
don't have to worry about that.
I didn't know. The tablet is for us, for the students, or we
Yes.
have to.
No, that's yours.
Oh, okay.
Okay. Because that's how you get on Red Shelf and all that. So.
Oh, okay.
Any other questions?
I got Blue Shelf.
Yes, that's right. All right, guys, I'll see you, and I will, as soon as I know about labs, I will let you know. I need that KitchenAid you got back there.
Mine?
Yes.
It's a Whirlpool.
I need one of those so bad. I need to tell you, the other day I said, I'm bacon. All right, guys, have a wonderful day.
You too. Thank you.
Bye-bye.
Bye.
Bye-bye.